Hey, Alpha Nurses and Licensure from alphanursguide.com. This is 20 practice questions. Without delay, let's get started.
A client is scheduled for an arteriogram. The nurse should explain to the client that the arteriogram will confirm the diagnosis of occlusive arterial disease by 1. Showing the location of the obstruction and the collateral circulation. 2. Scanning the affected extremity and identifying the areas of volume changes. 3. Using ultrasound to estimate the velocity changes in the blood vessels. 4. Determining how long the client can walk. The correct answer is 1. Showing the location of the obstruction and the collateral circulation. An arteriogram involves injecting a radiopaque contrast agent directly into the vascular system to visualize the vessels. It usually involves computed tomographic scanning. The velocity of the blood flow can be estimated by duplex ultrasound. The client's ankle brachial index is determined, and then the client is requested to walk. The normal response is little or no drop in ankle systolic pressure after exercise. The nurse is assessing an older Caucasian male who has a history of peripheral vascular disease. The nurse observes that the man's left great toe is black. The discoloration is probably a result of 1. Atrophy, 2. Contraction, 3. Gangrene, 4. Rubor. The correct answer is 3. Gangrene. The term gangrene refers to blackened, decomposing tissue that is devoid of circulation. Chronic ischemia and death of the tissue can lead to gangrene in the affected extremity. Injury, edema, and decreased circulation lead to infection, gangrene, and tissue death. Atrophy is the shrinking of tissue, and contraction is joint stiffening secondary to disuse. The term rubor denotes a reddish color of the skin. A client with peripheral vascular disease returns to the surgical care unit after having femoral popliteal bypass grafting. Indicate in which order the nurse should conduct assessment of this client. 1. Post-operative pain. 2. Peripheral pulses. 3. Urine output. 4. Incision site. The correct order is 2. Peripheral pulses. 4. Incision site. 3. Urine output. And 1. Post-operative pain. Because assessment of the presence and quality of the pedal pulses in the affected extremity is essential after surgery to make sure that the bypass graft is functioning, this step should be done first. The nurse should next ensure that the dressing is intact, and then that the client has adequate urine output. Lastly, the nurse should determine the client's level of pain. Which of the following lipid abnormalities is a risk factor for the development of atherosclerosis and peripheral vascular disease? 1. Low concentration of triglycerides. 2. High levels of high-density lipid cholesterol. 3. High levels of low-density lipid cholesterol. 4. Low levels of LDL cholesterol. The correct answer is 3. High levels of low-density lipid cholesterol. An increased LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down in the liver, but is deposited into the intima of the blood vessels. Low triglyceride levels are desirable. High HDL and low LDL levels are beneficial and are known to be protective for the cardiovascular system. The nurse is assessing the lower extremities of the client with peripheral vascular disease. During the assessment, the nurse should expect to find which of the following clinical manifestations of PVD? Select all that apply. 1. Hairy legs. 2. Mottled skin. 3. Pink skin. 4. Coolness. 5. Moist skin. The correct answers are 2. Mottled skin and 4. Coolness. Reduction of blood flow to a specific area results in decreased oxygen and nutrients. As a result, the skin may appear mottled. The skin will also be cool to the touch. Loss of hair and dry skin are other signs that the nurse may observe in a client with PVD of the lower extremities. The nurse is obtaining the pulse of a client who had a femoral popliteal bypass surgery 6 hours ago. Which assessment provides the most accurate information about the client's post-operative status? 1. 2. 3. 4. The correct answer is option 4. The presence of a strong dorsalis pedis pulse indicates that there is circulation to the extremity distal to the surgery, indicating that the graft between the femoral and popliteal artery is allowing blood to circulate effectively. Option 1 shows the nurse obtaining the radial pulse. Option 2 shows the femoral pulse, which is proximal to the surgery site and will not indicate circulation distal to the surgery site. Option 3 shows the nurse obtaining an apical pulse. The nurse is planning care for a client who is diagnosed with peripheral vascular disease and has a history of heart failure. The nurse should develop a plan of care that is based on the fact that the client may have a low tolerance for exercise related to 1. Decreased blood flow. 2. Increased blood flow. 3. Decreased pain. 4. Increased blood viscosity. The correct answer is 1. Decreased blood flow. A client with PVD and heart failure will experience decreased blood flow. In this situation, low exercise tolerance may be related to less blood being ejected from the left ventricle into the systemic circulation. Decreased blood supply to the tissues results in pain. Increased blood viscosity may be a component, but it is of much less importance than the disease processes. A client is receiving cilostazol for peripheral arterial disease, causing intermittent claudication. The nurse determines this medication is effective when the client reports which of the following? 1. I am having fewer aches and pains. 2. I do not have headaches anymore. 3. I am able to walk further without leg pain. 4. My toes are turning grayish-black in color. The correct answer is 3. I am able to walk further without leg pain. Cilostazol is indicated for management of intermittent claudication. Symptoms usually improve within 2 to 4 weeks of therapy. Intermittent claudication prevents clients from walking for long periods of time. Cilostazol inhibits platelet aggregation induced by various stimuli and improving blood flow to the muscles and allowing the client to walk long distances without pain. Peripheral arterial disease causes pain mainly of the leg muscles. Aches and pains does not specify exactly where the pain is occurring. Headaches may occur as a side effect of this drug, and the client should report this information to the healthcare provider. Peripheral arterial disease causes decreased blood supply to the peripheral tissues and may cause gangrene of the toes. The drug is effective when the toes are warm to the touch and the color of the toes is similar to the color of the body. An overweight client taking warfarin has dry skin due to decreased arterial blood flow. What should the nurse instruct the client to do? Select all that apply. 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced-calorie, reduced-fat diet. 3. Inspect the involved areas daily for new ulcerations. 4. Instruct the client to limit activities of daily living. 5. Use an electric razor to shave. The correct answers are 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced-calorie, reduced-fat diet. 3. Inspect the involved areas daily for new ulcerations. And 5. Use an electric razor to shave. Maintaining skin integrity is important in preventing chronic ulcers and infections. The client should be taught to inspect the skin on a daily basis. The client should reduce weight to promote circulation. A diet lower in calories and fat is appropriate. Because the client is receiving Coumadin, the client is at risk for bleeding from cuts. To decrease the risk of cuts, the nurse should suggest that the client use an electric razor. The client with decreased arterial blood flow should be encouraged to participate in ADLs. In fact, the client should be encouraged to consult an exercise physiologist for an exercise program that enhances the aerobic capacity of the body. The nurse is assessing a 48-year-old client with a history of smoking during a routine clinic visit. The client, who exercises regularly, reports having pain in the calf during exercise that disappears at rest. Which of the following findings requires further evaluation? 1. Heart rate 57 beats per minute. 2. Oxygen saturation of 94% on room air. 3. Blood pressure 134/82. 4. Ankle brachial index of 0.65. The correct answer is 4. Ankle brachial index of 0.65. An ankle brachial index of 0.65 suggests moderate arterial vascular disease in a client who is experiencing intermittent claudication. A Doppler ultrasound is indicated for further evaluation. The bradycardic heart rate is acceptable in an athletic client with a normal blood pressure. The oxygen saturation is acceptable. The client has a smoking history. A client is scheduled to have an arteriogram. During the arteriogram, the client reports having nausea, tingling, and dyspnea. The nurse's immediate action should be to 1. Administer epinephrine. 2. Inform the physician. 3. Administer oxygen. 4. Inform the client that the procedure is almost over. The correct answer is 2. Inform the physician. Clients may have an immediate or a delayed reaction to the radiopaque dye. The physician should be notified immediately because the symptoms suggest an allergic reaction. Treatment may involve administering oxygen and epinephrine. Explaining that the procedure is over does not address the current symptoms. A client has peripheral vascular disease of the lower extremities. The client tells the nurse, "I've really tried to manage my condition well." Which of the following routines should the nurse evaluate as having been appropriate for this client? 1. Resting with the legs elevated above the level of the heart. 2. Walking slowly but steadily for 30 minutes twice a day. 3. Minimizing activity. 4. Wearing anti-embolism stockings at all times when out of bed. The correct answer is 2. Walking slowly but steadily for 30 minutes twice a day. Slow, steady walking is a recommended activity for clients with peripheral vascular disease because it stimulates the development of collateral circulation. The client with PVD should not remain inactive. Elevating the legs above the heart or wearing anti-embolism stockings is a strategy for alleviating venous congestion and may worsen peripheral arterial disease. A client with heart failure has bilateral +4 edema of the right ankle that extends up to the midcalf. The client is sitting in a chair with the legs in a dependent position. Which of the following goals is the priority? 1. Decrease venous congestion. 2. Maintain normal respirations. 3. Maintain body temperature. 4. Prevent injury to lower extremities. The correct answer is 1. Decrease venous congestion. Decreasing venous congestion in the extremities is a desired outcome for clients with heart failure. The nurse should elevate the client's legs above the level of the heart to achieve this goal. The client is not demonstrating difficulty breathing or being cold. The nurse should prevent injury to the swollen extremity. However, this is not the priority. When assessing an individual with peripheral vascular disease, which clinical manifestation would indicate complete arterial obstruction in the lower left leg? 1. Aching pain in the left calf. 2. Burning pain in the left calf. 3. Numbness and tingling in the left leg. 4. Coldness of the left foot and ankle. The correct answer is 4. Coldness of the left foot and ankle. Coldness in the left foot and ankle is consistent with complete arterial obstruction. Other expected findings would include paralysis and pallor. Aching pain, a burning sensation, or numbness and tingling are earlier signs of tissue hypoxia and ischemia, and are commonly associated with incomplete obstruction. The nurse is unable to palpate the client's left pedal pulses. Which of the following actions should the nurse take next? 1. Auscultate the pulses with a stethoscope. 2. Call the physician. 3. Use a Doppler ultrasound device. 4. Inspect the lower left extremity. The correct answer is 3. Use a Doppler ultrasound device. When pedal pulses are not palpable, the nurse should obtain a Doppler ultrasound device. Auscultation is not likely to be helpful if the pulse isn't palpable. Inspection of the lower extremity can be done simultaneously when palpating, but the nurse should first try to locate a pulse by Doppler. Calling the physician may be necessary if there is a change in the client's condition. The nurse is teaching a client about risk factors associated with atherosclerosis and how to reduce the risk. Which of the following is a risk factor that the client is not able to modify? 1. Diabetes. 2. Age. 3. Exercise level. 4. Dietary preferences. The correct answer is 2. Age. Age is a non-modifiable risk factor for atherosclerosis. The nurse instructs the client to manage modifiable risk factors such as comorbid diseases, such as diabetes, activity level, and diet. Controlling serum blood glucose levels, engaging in regular aerobic activity, and choosing a diet low in saturated fats can reduce the risk of developing atherosclerosis. When assessing the lower extremities of a client with peripheral vascular disease, the nurse notes bilateral ankle edema. The edema is related to 1. Competent venous valves, 2. Decreased blood volume, 3. Increase in muscular activity, 4. Increased venous pressure. The correct answer is 4. Increased venous pressure. In PVD, decreased blood flow can result in increased venous pressure. The increase in venous pressure results in an increase in capillary hydrostatic pressure, which causes a net filtration of fluid out of the capillaries into the interstitial space, resulting in edema. Valves often become incompetent with PVD. Blood volume is not decreased in this condition. Decreased muscular action would contribute to the formation of edema in the lower extremities. The client admitted with peripheral vascular disease asks the nurse why her legs hurt when she walks. The nurse bases a response on the knowledge that the main characteristic of PVD is 1. Decreased blood flow, 2. Increased blood flow, 3. Slow blood flow, 4. Thrombus formation. The correct answer is 1. Decreased blood flow. Decreased blood flow is a common characteristic of all PVD. When the demand for oxygen to the working muscles becomes greater than the supply, pain is the outcome. Slow blood flow throughout the circulatory system may suggest pump failure. Thrombus formation can result from stasis or damage to the intima of the vessels. The nurse is caring for a client with peripheral artery disease who has recently been prescribed clopidogrel. The nurse understands that more teaching is necessary when the client states which of the following: 1. I should not be surprised if I bruise easier or if my gums bleed a little when brushing my teeth. 2. It doesn't really matter if I take this medicine with or without food, whatever works best for my stomach. 3. I should stop taking Plavix if it makes me feel weak and dizzy. 4. The doctor prescribed this medicine to make my platelets less likely to stick together and help prevent clots from forming. The correct answer is 3. I should stop taking Plavix if it makes me feel weak and dizzy. Weakness, dizziness, and headache are common adverse effects of Plavix, and the client should report these to the physician if they are problematic. In order to decrease risk of clot formation, Plavix must be taken regularly and should not be stopped or taken intermittently. The main adverse effect of Plavix is bleeding, which often occurs as increased bruising or bleeding when brushing teeth. Plavix is well absorbed, and while food may help decrease potential gastrointestinal upset, Plavix may be taken with or without food. Plavix is an antiplatelet agent used to prevent clot formation in clients who have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. A client with peripheral vascular disease has undergone a right femoral popliteal bypass graft. The blood pressure has decreased from 124/80 to 94/62. What should the nurse assess first? 1. IV fluid solution. 2. Pedal pulses. 3. Nasal cannula flow rate. 4. Capillary refill. The correct answer is 2. Pedal pulses. With each set of vital signs, the nurse should assess the dorsalis pedis and posterior tibial pulses. The nurse needs to ensure adequate perfusion to the lower extremity with the drop in blood pressure. IV fluids, nasal cannula setting, and capillary refill are important to assess. However, priority is to determine the cause of drop in blood pressure and that adequate perfusion through the new graft is maintained.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.